When the patient then does go home, I expect the patients to be working with therapy, walking daily. I expect the patient to be able to ride a bike, inside usually at about 4 weeks, but outside usually at about 6 weeks. It gives the patient a good amount of time to achieve that goal. I think that walking on uneven ground, such as walking on the beach or walking in the yard, mowing the lawn, I think that starts around 6 weeks to feel comfortable doing so. I usually let them chip and putt whenever they can stand up and walk by themselves, usually at about 2 weeks. If we're talking about going to the driving range, I usually don't let patients go to the driving range for about 6 weeks. And at that point, it's progressive. So 6 weeks with the high irons, such as pitching wedge, sand wedges. Then at 8 weeks, I add the higher irons, 9 iron, 8 iron, then lower irons by somewhere between 10 and 12 weeks. I don't let people swing a driver for about 4 months. I'm okay with patients doing yoga pretty much when they can walk by themselves at home, somewhere around 2 and 3 weeks. However, there are going to be some limitations at first because that inside tissue, that healed tissue, doesn't happen for about 6 weeks' time. So there'll be some things that are limitations with yoga. I have a lot of patients that have interest in triathlons that continue to do them through hip pain now and want to get back to it as soon as possible. However, swimming I usually don't start until about 6 weeks. You can get into a pool at 4 weeks, but truly swimming laps will start building up at about 6 weeks. Running, I will not let anybody run for a period of 3 months. It's just important to allow maximum bone healing and muscle healing to get that good running base. And the worst thing I would want for my patients is to start an activity and then having to stop it because they're in pain. So I make people wait that extra little bit because it's worth it for longevity purposes. If you've been having hip pain or think you may be a candidate for a hip resurfacing arthroplasty or have been told you needed a total hip arthroplasty and are unsure about undergoing that kind of a surgery and still want to remain active, please don't hesitate to contact our office, schedule an appointment with me at JOI 2000 or go to www.joi.net.